The first week of October is Mental Illness Awareness Week. It's meant to get us talking so we can help break the stigma surrounding mental health. Now, you don't have to have a clinical diagnosis to care about this. At some point, we have all struggled. Recently, I caught up with Portland psychologist Keith Dempsey. Here's part of our conversation, starting with how the pandemic made it okay not to be okay.
That's what COVID-19 did. It kind of brought us together because then we were able to say, we all went through something. You know, therefore, okay, now maybe we can talk about it a little bit. It's okay to say, okay, I need some counseling. Why? Oh, because of this pandemic thing. And then people would say, yeah, that was tough.
So you've been practicing here in Portland for 25 years.
Yeah.
You're seeing more Black folks come in for counseling.
Yep.
Say more about that.
You know, we found other ways to cope before, but things have gotten so tough that for the first time people are saying, okay, I'm willing to try. So like I said, I'm really happy about it, but there's some challenges, you know, with that because research says that when Black folks come to counseling, they want to see someone Black. A lot of times when people say, hey, the stigma, you know, people need to get past the stigma, folks don't realize that the stigma came from somewhere. So a lot of times Black folks, they say, you know, we don't go to counseling, we go to church. What goes on in this home stays in the home. And that comes from a history of being hurt and mistreated in these systems. So your question, it's incumbent upon professionals to be able to create systems that are anti-racist, to be able to be culturally sensitive and responsible, no matter who you look like, but creating a safe place so that everybody can come and seek some counseling.
It is hard to find a good therapist. Yeah. Everybody is kind of flooding into that space.
Absolutely.
So what if you can't find one?
Well, if you can't find a good therapist, what you want to do is you want to find something that's therapeutic. And what I mean by that is maybe there's a church group that you have, that folks are there and they can listen. And that's the biggest thing. It's therapeutic when you can have someone who's really listening and attentive to you. And I always say mental health is not something to be ashamed of. It's a human experience, just to be able to talk about that human experience.
So our thanks to Dr. Keith. He does have a practice here in Portland on Northeast Broadway. Another great resource is NAMI, the National Alliance on Mental Illness. They have chapters in Oregon and Washington. You can go to NAMI.org to find one near you.